People everywhere, young and old alike, want to look and feel more attractive. The way people see themselves and the way others see them affects not only their social lives, but their productivity at work. And to maintain that healthy self-attitude, many people seek out a dentist that can offer them whiter teeth and a healthy, attractive smile.
Here at the Center for Aesthetic Dentistry, we've been whitening teeth for years, and we've had the opportunity to evaluate virtually every system for bleaching that's on the market. We've seen many improvements over the years, both in materials, techniques, and methods, but nothing has seen quite the quantum leap as the LumaArch. The improvements have been astounding for us. One of the concerns over the years has been heat sensitivity. The LumaArch delivers no heat whatsoever. In fact, the entire visit is comfortable and can be completed in less than 30 minutes. There's no doubt in my mind that the LumaArch bleaching system represents a quantum leap in simplifying in-office bleaching systems today.
A quantum leap indeed. But what makes the LumaArch system so effective compared to other systems? To understand the answer, we first have to understand the role of hydrogen peroxide in tooth whitening. Since it was first reported in the dental literature, there have been literally hundreds of articles published which clearly establish the safety and efficacy of hydrogen peroxide in the whitening and bleaching of teeth. Chromogens, complex, long chains of organic molecules which can develop from a variety of factors, cause teeth to absorb rather than reflect light, thus making them appear darker, stained, or spotted. However, oxygen radicals, which are a decomposition byproduct of hydrogen peroxide, will attach to these long-chain chromogens and break them down into smaller molecules that are more highly reflective, thus making the teeth appear brighter. And no tooth whitening system on the market is as well designed to rapidly optimize the bleaching effect of hydrogen peroxide as is the affordable LumaArch. There are several unique features of the LumaArch system which are the key to its user-friendly performance and superior results. Let's look at some of these in a little more detail. First, note the unique shape of the full smile illuminator, the working end of the system. It is easily adjusted to fit the patient's smile, and the wraparound design creates an even exposure of halogen xenon light across both top and bottom arches at the same time. This feature eliminates the tedious and time-consuming requirement of other systems to bleach each tooth individually. With LumaArch, it's all done with a single push of a button. Another unique design feature is the 4 liquid light guides which direct the lights from the 4 bulbs in the base of the unit to the head of the full smile illuminator. The special clear fluid which fills the light guides transmits virtually all of the light energy while at the same time eliminating virtually all of the heat generated at the energy source. The result? A very pleasant, cool, and comfortable bleaching experience for the patient. Finally, the light source itself is specially built to produce a waveband of 350 to 530 nanometers of visible light energy, an optimal bandwidth for accelerating the photochemical decomposition of hydrogen peroxide, the active ingredient in the LumaArch bleaching gel. Now, let's follow a typical whitening procedure, and let's time it from start to finish. First, the dentist or hygienist makes a pre-op shade match so we can measure the improvement when we're finished.
It looks like a C3 for me.
Fit the patient with protective eye goggles, then polish the teeth with flour of pumice to remove any surface biofilm that may be present. Next, retract the tongue and cheeks using a comfortably fitting cheek retractor and cotton rolls. A little Vaseline on the lips will ensure extra comfort. Now, we're ready to begin. Air dry the area around the margin and apply a liquid dam. Make sure you cover the entire margin as well as any visible recessions. This protects the soft tissue and gums from any hydrogen peroxide gel that may accidentally leak under the margin. Then cure it for a few seconds until solidified. The cordless LumaCure curing light is ideal for this application. Now it's time to apply the hydrogen peroxide gel. Moving across both top and bottom arches, brush a layer of gel about 2 or 3 millimeters thick onto each tooth. Most clinicians prefer bleaching from canine to canine, but depending on the anatomy of your patient's smile, you may want to extend the bleaching to the first or second premolars. Now place the head of the LumaArch comfortably into position about an inch or so away from the exposed teeth. Check to see that the head of the unit is properly positioned and that the patient is comfortable. Press the start switch. The control panel is preset at the factory to count down for 8 minutes. At the end of the 8-minute cycle, there will be an audible tone, the light will shut off, and the timer will automatically reset itself for another cycle. Suction off the bulk of the exposed gel and, using damp gauze, wipe off the rest. Do not rinse. Now apply a second, fresh coat of gel to the teeth. Now repeat the exposure for another 8 minutes, and when the cycle is completed, aspirate as much gel as you can from the surface of the teeth. Then wipe and rinse well. Remove the cotton rolls, gingival barrier, cheek retractor, and goggles. The clock reads 28 minutes. Now let's see how well we've done.
Okay, let's see. Well, it looks like a B1 to me. So considering it started with C3, it's a great improvement. Give it a mirror. Check yourself.
Oh wow, I didn't think they'd get this white. Look great, thank you.
It's a pleasure.
The LumaArch bleaching system, a quantum leap in tooth whitening technology. Now, patients from all walks of life can enjoy the benefits of this revolutionary technology. Delivering full smile whitening in one short office visit. Bleaches both arches at the same time, with comfortable, no heat light guides. Can be performed in most cases by the hygienist or dental assistant. A great service for your patients